Hi, my name is Mark Angeli Dagdagan from the College of Nursing, and today I'm going to discuss the oropharyngeal and nasopharyngeal suctioning. There are four purposes for this procedure. Number 1 is to remove secretions from the airway. Number 2 is to facilitate ventilation. Number 3 is to obtain secretion for diagnostic procedure. And number 4 is to prevent infection. In assessment, we must assess the following. Number 1, we must assess clients' levels of consciousness and level of knowledge and understanding. Number 2, we must assess the client's vital signs. 3, assess client's breath sounds and signs and symptoms of respiratory distress. And lastly is we must assess availability and functionality of the needed materials. So here are the materials that we need to use in this procedure. Number 1 is suction machine. Number 2 is suction catheter, with the size per adult is 14 to 16 inches and per pediatric size is 8 to 12 inches. Next one is sterile gloves, irrigating saline or sterile water, large water or line saver, tongue depressor, and face mask for protection if patient coughs. The next one is the procedure. So the first thing that we need to do is check and verify the doctor's order and identify the client and explain the procedure. Then, we must do hand washing and put PPE as indicated and set the bed to a comfortable height to work and lower the side rails where we will work. The next thing to do is position the client. For the conscious patient, we must position them in semi-powerless position. For the unconscious patient, it is side-lying position facing toward the healthcare provider. After we position the client, place a drape or clean towel across the patient's chest. And then, turn on the suction machine. So, here are the unit of pressure that we need to regulate in suctioning the patient. After we regulate it, put a PPE if indicated, wear sterile gloves, and then connect the suction catheter to suction tubing connected with the suction device. Lubricate the tip of the catheter and insert the catheter either per nasopharyngeal or oropharyngeal. Then, we must apply suction for less than 15 seconds. Then, place the finger on the opening of the suction port and withdraw catheter by rotating catheter. The next thing that we need to do is place the tip of the catheter to a sterile solution to rinse the catheter with water until secretion is cleared. Then, we must repeat suctioning and limit it for 3 times a day because prolonged suctioning may result in acute hypoxia, cardiac arrhythmias, mucosal trauma, infection, and patient experiencing a feeling of choking. After suctioning the patient, we must encourage them to take deep breathing and coughing exercise between the suction. Next one is to evaluate respiratory status and vital signs of the patient. Then, turn off suction, disconnect suction catheter from tubing. Then, we must provide oral care and remove towel drape on the chest of the patient. Afterwards, we must provide the client safety, comfort, and privacy. And then, we must remove gloves and PPE and do hand washing. And lastly is we must document the procedure and other important data on the client's chart.